health care debate heating up even more next week. President Obama will make his case in front of a joint session of Congress Wednesday in a primetime address. Joining me live now on the phone is Republican Congressman Michael Burgess of Texas. He is a member of the Energy and Commerce Committee. He is also a doctor. And a good morning to you. Thanks for joining us.
Good morning, Alex. Great to be with you.
Well, I'm curious what you expect to hear from the president on Wednesday in the speech to Congress, and could he say anything that gets you on board with the health care reform?
Well, I can tell you what I'd like to hear. In fact, they haven't been on the phone with me this morning asking my opinion, but if they would like it, what I would like to see is for us to take a step back. Let's fix some of the things that really need to be fixed right now. We don't have a lot of credibility to spend right now with the American people, but if we would work on things like providing coverage for those with pre-existing conditions, if we would work on things like the insurance companies who do the rescissions and take away the coverage from people when they need it the most, if we would work on that fundamental type of insurance reform and really help the 8 to 10 million people who are in great difficulty right now with getting coverage, I think that would go a long way towards reestablishing some of that credibility. Then we can work on affordability, we can work on transparency, and all of those other concepts that people would like to see us do, those are available to us as well, and we can work on those. There's no reason that we can't pick up and work on those after we get some of those first done.
How about your constituents, Representative Burgess? Do you get a sense of how they feel about health care reform? Do they feel it is necessary in some form right now?
I don't think there's anyone who disagrees with the president when he says he doesn't like the status quo. I practiced medicine for 25 years. I didn't like the status quo. I am grateful that insurance companies now are willing to come to the table and work on some reforms, that they acknowledge that reforms are important, but it doesn't mean that we have to turn the entire system on its head or to risk turning it over to the federal government. After all, they've got half of it right now anyway, and they're not doing a great job.
I'm curious, as a physician, and I'm going to tell you I've heard an earful from my father who's a physician, what is the most frustrating thing that you deal with when it comes to the insurance companies? Is it the paperwork and all that, or is it the fact that insurance companies will often tell you this isn't going to be covered if you want to ask for certain tests and that sort of thing?
Well, there are two worlds right now. There's the public world, Medicare and Medicaid, where there's not a lot that goes on as far as pre-authorization, and that opens them up to fraud on occasion. And then you have the private side where, pre-authorizations are the law of the land, and you spend a lot of time on an 800 number trying to get your patient the care that they need. Well, there has to be a better way. The better way is to let the doctor and the patient be in charge of those decisions. The insurance company, certainly they have some obligation for oversight. In fact, the federal government has some obligation for oversight that they're not doing right now. But at the same time, we can't always be second-guessed about our medical decisions.
Will there be a health care reform bill signed before the end of the year? And if there is no public option, will you go along with it?
Oh, it's very hard to tell because right now it's, as you know, all of the pieces are in flux. The public option was clearly a non-starter for me because, again, I don't think we've done a good job with Medicare and Medicaid that we already have, over which we already have control. If we didn't have the private sector propping up the federal portion right now, Medicare and Medicaid wouldn't work. At the same time, I think this president knows that they've put a lot of credibility on the line about a health care bill. Fully expect at some point they'll declare victory and sign what they can take at that time. I really hope there's a sense that after people have seen what's gone on this summer at the town hall, we get back to Washington and we work seriously on this for the and get some deliverables the American people actually want. We've heard from them. We know what they want. Now it's a question of getting down and getting it done.
Okay, Republican Congressman Michael Burgess of Texas, thank you very much for your time on MSNBC Saturday. Have a great weekend.
Thank you.
For your daily politics fix.